So today I would like to talk to you about some of the work that I'm doing as part of my fellowship, and it's looking at the benefit receipt among mental health service users. So in the UK, about 1.8 million people are out of work each year, and of those who are out of work, about 1 in 3 claim sickness or unemployment-related benefits as a result of mental ill health. So many of us will know people who may have a mental health problem or have been out of work for a longer duration. So on an annual basis, this costs the UK about £100 billion a year. So you can see that it's also quite politically sensitive because of the huge costs attached to that. And about 900,000 people claim sickness or unemployment-related benefits each year, and 1 in 3 of these are in general due to mental health conditions. So as a result of these trends that we more or less see, there have been major changes in the welfare system in the UK. So the welfare system is like the social security system that provide, for example, benefits to people who are in need. So the UK government introduced, for example, universal credit, but also personal independence payments. So the latter are for disability-related payments. And also there's an increased reliance on conditionality and benefit sanctions. So it means that conditionality means that if you are looking to claim benefits, if you get accepted, you may need to do certain things to maintain your entitlement to these benefits. I will go into that a little bit more in detail. For those who do not know that much about the welfare system, so in general in the UK, the Department for Work and Pensions is responsible for welfare, pensions and child maintenance policy. It's the UK's biggest public service department, and it administers the state pension, so for people who are retired, but also a whole range of working age, disability and ill health benefits. They are in contact in general every year with about 20 million claimants. So if you consider that in the UK, I believe we have like a population close to 70 million, about 1 in 3, 1 in 4 people in the UK are in contact with the DWP on an annual basis. You can also imagine that it comes with a huge cost. So where does the DWP spend its money? So it's actually the department that has the biggest spending budget. So in 2021 to 2022, they spent over £200 billion related to benefits. So here you can see that a large chunk of that is going for pensions, so about 110 billion. But also there's a large chunk going, about 60 billion, to benefits for people who are working age, and also about 30 billion a year for disability-related benefits. So these are big sums of money that the DWP is working with. So in 2003, the Department for Work and Pensions introduced universal credit, or more or less the UK government introduced that. So this benefit replaced 6 previous benefits and also tax credits. So universal credit is targeted at those out of work, people who are unable to work, and also people who are on a low income. So universal credit is means tested. So it means that if you, for example, have savings on the bank, you may get universal credit that's a little bit less, or you may not be eligible to claim universal credit at all. So the government argued that they would introduce universal credit to streamline and simplify the welfare system. So not only for the people working for the Department of Work and Pensions administering these benefits, but also, for example, for people who are looking to claim benefits. Because you can imagine if you need to claim 6 different benefits via 6 different systems, it can be quite complicated. So they're going to streamline the whole system. And also, of course, they would want to encourage more people on benefits to gain and sustain paid employment. So it's anticipated that there will be 7 million households on universal credit. And the rollout would start in 2013 and was expected to be finished by now. But there were lots of delays in the rollout of universal credit. And of course, we also had the COVID-19 pandemic. So currently, I believe there are about nearly 3 million households on universal credit. So not everyone is on universal credit yet. And as I said, there's an increased reliance on conditionality. So it means that you need to do certain things like activities or tasks if you are getting universal credit. And what you need to do depends on the group of universal credit you are in. And for those who might be interested in how much universal credit actually is, I just want you to take like maybe 10 seconds to think like, well, if you were about to claim universal credit, how much money do you think you would get from the government on a monthly basis? So I wonder in one way how many people thought that you would only get around £300 a month if you were single under 25 years of age. And of course, if you're a little bit older, you get a little bit more, but also if you live with a partner, for example, you don't get like £600 if you would just add things up, but there will be a slight reduction. Of course, this is just universal credit in itself. If you, for example, have a health condition or disability, you can receive up to £300 extra on top of your universal credit. However, I think it's important to keep in context about how much money is involved in that, and in one way, actually, how little money to live off on a monthly basis. I also wanted to flag that in the UK, the government over the years has taken more of a stick approach in getting people back to work than a carrot approach. So in this sense, it means like there's more conditionality that people need to do to maintain their entitlement to benefits. So people are expected to go to a work coach, they are expected to turn up for an interview, they are expected to accept a job if offered, and otherwise they are getting sanctioned. So it means that their benefits can be suspended or reduced for a particular period of time. And also the government is convinced that by using this approach, it will encourage more people to take up paid employment. However, one might also wonder whether a lot of these people have a genuine choice to do that. So for universal credit, as I said, depending on your circumstances, you will get allocated to certain activity groups. And they are in general called work-related activity groups. So the top two, for example, is searching for work and working with requirements. You can see like there are certain criteria for work. So the top group, the searching for work, is for people who are fit to work. They might be unemployed, or they are in work but have very low earnings. So in this case, it's expected that you search for work for at least 35 hours a week, if you're unemployed in this case, to ensure that you get the money from the universal credit, as well as you meet your work coach on a regular basis. And in general, this means face-to-face meeting every other week. You can also be working but with requirements. So you are in work, but you are earning under a certain threshold that the government has established. So your income is under a certain threshold. So it means like the government is encouraging you to find a better paid job or start to look for more hours to top up your income. Again, there are certain expectations. So for example, you need to go to regular work coach meetings to discuss any progress you may make. Then also we have four other groups. So the middle two, the no work requirement groups, are people who have limited capability for work. So these are often the people who have like a long-standing health condition or disability and are just not able to work. So they're unfit for work. This can also be like full-time carers, so if people are main carers for a child under the age of 1. So in general, these people do not need to do anything to look for work. So these people are not facing the conditionality that I've talked about before. Then we also have the people who are working and they are not facing any requirements. So they are in work and earning over the threshold that the government has stated. So again, they have no requirements to ensure that they keep being entitled to their universal credit. Then, of course, there are two other groups. These are often related to people who have children of a younger age. So it's a planning for work and a preparing for work group. And in general, you may need to look for work coach meetings or go to training, but that are all the expectations in this case. Once your child or that you're caring for is reaching a certain age, then often these people will move into the searching for work group. So I just wanted to flag here to show some trends over time on which work activity group or conditionality regime people are allocated to in general. So as I said, universal credit was only rolled out from 2013 and it was quite slow in the beginning. It really picked up pace like from 2017 onwards, so that's why it starts so low. So the people before that, they were mostly all on the legacy benefits that universal credit replaced. So here you can see that the majority of the people who claim universal credit are in the searching for work group. So that are the people who have the most intensive conditionality regime. We also see that there are a sizable group of people who are in the no work requirement groups. That's about 1.5 million people. And also we have a group of people who are in the working with requirement group, so 1.2 million. So you see also a really big peak around March 2020. So that's, of course, when COVID-19 came and various, furlough and shutdowns or lockdowns happened. So you can also really see that in the data. So the number of people who are looking for work increased substantially. So, and as I said before, like if you are in a group that has a conditionality, you need to keep up with the requirements. So go to do the job searching or go and speak to your work coach on a regular basis. And if you're not doing that, you can get sanctions. So this means that your payments for universal credit may be reduced or suspended. And the sanction can last between 7 to 182 days, and the length of the sanction depends on the reasoning for the sanction, as well as whether this has happened often. So, for example, in general, if you do not turn up for your appointment with a job coach, it's likely you will get sanctioned straight away for 7 days. This can be that your universal credit is getting partly reduced, or it can be completely suspended. So you're not receiving any money until you turn up for your next appointment with your work coach. So here you can see from, say, end of 2019, what the percentage is of people who were receiving universal credit and were subject to conditionality. So on an average, you can see that at the start, around 3% were sanctioned at any given point in time. Then we have a big drop in 2020, because over the course of the COVID-19 pandemic, the government decided that sanctioning, that they would not do that, more or less, unless people were already sanctioned from before. So that's why it's dropping that far. And then goes all the way back up to the numbers that we are currently seeing. Well, that's early 2023, but the sanctioning at this given point in time is at the highest possible percentage that we have seen so far since the introduction of universal credit. So in general, at any point in time, 6 to 7 people who are in a universal credit work activity related group and who are subject to conditionality are being sanctioned. And also, it's very interesting that despite all these changes and also the possible negative implications all these welfare changes may have on claimants, we do not have a lot of data, for example, about what are the mental disorders universal credit claimants may have been diagnosed with. We have barely seen any data available at scale about the ethnicity and the people who are receiving universal credit, or like also the interrelationships between protective characteristics, mental disorders, and universal credit received. And also, we really don't know that much about the uptake of universal credit among people who access secondary mental health care services. And as I said, 1/3 of the people who fall out of work as a result of sickness absence, this was as a result of mental ill health. So you can also imagine that among people who claim universal credit, I think now what create could mean, but I won't put that word in your head now. Who claim universal credit, people who have a mental disorder might be overrepresented. So we set out to create a unique linked data set. So after about 6 years of negotiations with the Department for Work and Pensions, we managed to link up mental health records from the South London and Maudsley NHS Foundation Trust with administrative benefits records from the Department for Work and Pensions. So this is the first time ever in the UK that electronic mental health care records have been linked with benefits records from the DWP. So we had a very high linkage rate of 93% that we were very pleased about. Despite that, of course, we did not have access to like people's unique personal identification numbers or national insurance numbers in this case. So we managed to link over 400,000 electronic healthcare records with benefit records, and we can follow people over a period of 15 years, how they move in and out of the benefit system, but also how they move in and out of the mental health care system. However, it's important to note that only people who access these secondary mental health care services is the people we have data on. We do not have data on a general population sample who did not access mental health care services in SLAM. So I would like to show you a little bit of the data related to universal credit receipt in this important population of mental health service users. So after applying a lot of different in- and exclusion criteria, for example, age, we were left with nearly 145,000 patients who had access SLAM and whose records were linked. And over the study period, so that was between 2013 towards the end of 2019, approximately 1 in 4 had received universal credit at some point. Just over half were male, the average age was about 37, slightly over half came from a white background, and 68% had a recorded primary psychiatric diagnosis. So it also means that around 32% had not received a primary psychiatric diagnosis. And when we looked a little bit closer at this data, this was more or less due to the time they started entering mental health services. You can imagine that it takes time to get a diagnosis. So a lot of these people only had been in SLAM for a little while, so they may not have received a psychiatric diagnosis. And as I said before, nearly 40,000 out of the 140,000 had received universal credit between 2013 and 2019. So here you can see how the uptake of universal credit went for this sample of mental health service users. So as I said, officially universal credit was rolled out in 2013, but this was only very limited in the northwest of England. Only around 2015, 2016, universal credit was made available in the catchment area of the South London and Maudsley NHS Foundation Trusts. So that's why we see this uptick in people who are receiving universal credit in our sample of mental health service users. And we would expect this, of course, to increase more steadily over time once the years get added, so 2020, 2023, etc., further on. So we also had a look at what factors are associated with receiving universal credit. So we found that women were slightly less likely to receive universal credit than men. Younger age groups were more likely to receive universal credit. We also saw quite a varied picture for ethnicity. So people from a Black background and mix of multiple racial and ethnic groups were more likely to have received universal credit. And we also found that, what was of course not unexpected, that for people who were living in more deprived areas, they are more likely to have received universal credit than those living in less deprived areas. Because also, of course, universal credit is targeted to those out of work, but also people who are on low income. So they might get an income supplement. And we measured deprivation by the index of multiple deprivation. So it's like a score that you get based on the geographical area you're living in. And then we saw some very interesting findings with regards to psychiatric diagnosis. So we actually found that those with a psychiatric diagnosis were less likely to have received universal credit compared to those who did not receive a psychiatric diagnosis. And we think this is due to people still being on the legacy benefits that universal credit intended to replace. So some of the benefits that universal credit is replacing are, for example, housing benefit, employment and support allowance, and job seekers allowance. So in here you can see that there's still about 70,000 people in our sample receive these kind of legacy benefits and we're not on universal credit yet. And also universal credit was first rolled out to people who were newly claiming universal credit. So they hadn't claimed any of the legacy benefits before, but also people who were in more less complex situations. So people who were single, who were not living together, who may not have had children, or indeed who may not have had a long-standing health condition or disability. So because the migration from legacy benefits to universal credit had been delayed, we think those people who were in more complex situations, like people who live in more deprived areas, but also people with mental ill health, especially chronic mental ill health, are still on the legacy benefits that will partly explain the findings that I just showed you. I also just wanted to show you a little bit about of the people who access mental health conditions. So who is subject to conditionality? So who is in the regimes where we put a lot of requirements on the claimants to maintain their entitlement to universal credit? So here you can see that despite all these people access secondary mental health care services, still about 18,000 were in the searching for work group. So they were still subject to the highest level of conditionality. And we also see the other two that I circled are working with requirements and preparing for work and planning for work. There are still sizable groups of people who are subject to conditionality. Of course, we also have nearly 10,000 people who had no work requirements as a result, most likely of a long-standing health condition or disability that prevents them from working. So what we found was associated with these conditionality or work-related activity groups. So we found that women were less likely to be in the searching for work group, however, than men, but they were more likely to be in the no work requirement group. We also found that people in the younger age group were less likely to be in the no work requirement group compared to older age groups. And one can imagine why that might be, because like once you age, there's a higher likelihood of developing, like, for example, long-standing health conditions that may impact on your ability to work. We also saw that people from Black or mixed and multiple racial and ethnic groups were more likely to be in searching for work groups than those from a white background. And here we did see that people who had a severe mental illness diagnosis were more likely to be in the no work requirement group. And that's something that we would expect. You can imagine that when you have a serious mental illness like psychosis, you're just not fit for work. So just to summarize this very briefly. So first of all, it is possible to link benefits data with electronic mental health care record data in the absence of a unique identifier. We also found that in people who access secondary mental health care services, about 1 in 4 had received universal credit at some point in time over a 6-year window. We really think that the profile of universal credit received will change over time, because as I said, the rollout of universal credit is still being finalized, and people who are in more complex situations are currently being migrated from legacy benefits to universal credit. We found something unexpected regarding psychiatric diagnosis, and we think it's due because people are remaining on legacy benefits and haven't moved over to universal credit yet. And also, we actually felt that there was quite a large number of mental health service users who were subject to conditionality. And we really think that's important that welfare policy considers this important group of people in their strategies to try to get people back to work or support them where possible. Thanks very much. So there's some further reading on here, and now happy to address any questions. Are there any questions?
Sharon, I've got a comment to make.
Yeah, please comment.
Okay.
Hey, Anne.
Hi, Sharon. Thank you so much. That was really interesting. I'm just wondering about the length of time that it takes to get a psychiatric diagnosis. Yeah. You've got your two groups. So there's a group that had no psychiatric diagnosis and the other group which had.
Yeah.
So that group's potentially waiting and living with probably severe mental health symptoms. The other group that's had the diagnosis will then be on treatments. And I know you mentioned that some of those will be in a group that's not fit for work.
Yeah.
But there may be another group that does become fit for work. And I just wondered if any of that information came through from your study, whether they were then going back onto the looking for work, and then that might impact the fewer people who've had a psychiatric diagnosis, that lower number.
Yeah, so I think of course, people can move in between the universal credit categories. So for now, we just mapped whether people were in it on a yearly basis. So there's definitely something we need to start looking at, how the temporality between getting universal credit, your psychiatric diagnosis, and then possibly return to work, because you're completely right. A lot of people will have had treatment and hopefully got better. So did they then move up or move down, however you want to say it, into the searching for work group? So I think that's something for us to look at. For now, you can probably also understand the data is incredibly complex. So we really started off very descriptive. And I really hope it's an excellent point you make that we need to look at in more close detail. But yes, there are people who would have moved across the categories that we need to look at and may have returned to the workplace. The downside of this data is there's very little interchange of data between the Department for Work and Pensions and HMRC. So we did not get actual return to work. We only can assume people return to work if they no longer received certain benefits. Because it would have otherwise be a three-way linkage with DWP and HMRC. But in one way, this is how DWP does it as well to a certain extent. But yeah, great question. Thank you. I also see some questions in the chat. Let
me try and help. Sharon, has anybody got their hand up?
Not yet, but I see a question from Paul.
Okay.
So yeah, the linkage. So DWP did the linkage on our behalf. So we sent just personal identifiers to the DWP. They then used the deterministic fuzzy linkage with their identifiers, and then the linked IDs and the non-linked IDs were sent back to us, and then we attach more or less the clinical information to it. And also, I think we are very lucky that, and I didn't touch on this today, is we know who didn't link. So we were also able to generate linkage weights that we took into account in some of our initial analysis to adjust for the people who were less likely to be linked. So, for example, we found that women were less likely to be linked, as well as people from ethnic minority backgrounds. And of course, there are different explanations for that, like women may change their name when they get married, and also people from ethnic minority backgrounds, there might be more spelling mistakes in their names. So if you then use a deterministic linkage approach, you may miss out of those people. So yeah, it's a very high match rate indeed, despite that we did not have the NINO or an NHS number. So we're very pleased with that. The beauty, of course, is DWP has the customer information system, what has is technically linked to the national insurance number. So once they've matched the personal identifiers we gave them, they then matched it to the details they held on someone's national insurance number. So I think that really helped as well. And also, Kathleen had a question about whether we are able to determine among those who are on UC in the mental health group, whether they received UC due to mental health or other reasons. So it's very interestingly that the DWP does not necessarily collect data on what type of health condition people put forward as a reason why they might be unfit for work. So we have that data on ESA, and some of the other legacy benefits that preceded universal credit. So it's still, at some point, we do want to do a corroboration exercise between what did claimants put on their form, and if it was mental health, did it more or less correspond with what we see in the SLAM electronic mental health care records? But we haven't really gotten to that. And also, because the welfare system has moved to universal credit now, I think it's still very relevant to look at it, but we haven't been able to do that, and we can't do that for universal credit, sadly. Are there any other questions? All quiet.
Sharon, it was an absolutely brilliant talk, and I know you've been working away for several years on this, and there was a big background, so about 5 or 6 years prior to that, talking with DWP about getting this linkage done. So, but it's a huge, it was a huge piece of work. You've done brilliantly with it. So very, very complex data, and I always admire your clear thinking approach with massive data sets and asking important questions. And one of the things that we've talked about that might be helpful for others on the call is that looking at the impact of this work and what it might tell us. And one of the things we've talked about is if we know that people with certain mental health conditions are on benefits for a long time and they stay on the benefits, then is it worth them really having their work, their assessments, their work capability assessments frequently? Because actually, if they always remain on them, then actually the government could stop those work capability tests, which are expensive, they're stressful,
Exactly.
So I think that's an important point.
And also the government, so I only talked about universal credit because it's already complex enough. So the benefit ERA referred to is called personal independence payments. So it's for people who have a long-standing health condition or disability, and as a result of that condition, they may incur additional costs to just getting around the house or seeing friends. They may need to take a cab, or they may need a wheelchair to do certain things. And people get reassessed on a frequent basis to see whether they still meet the criteria and still are eligible to take up their benefits. And yes, the government has a severe condition strategy that does not really include any diagnosis or conditions, but that are often like terminal illnesses or diseases that we know are just getting progressively worse instead of better. But you can, as ERA hinted at as well, is like, well, if we, for example, see that people have a diagnosis of psychosis, if in general they have this benefit called PIP for about 10 years, what's the point of assessing them every 2 to 3 years? Because, of course, it comes at a huge cost mentally, personally, to patients who need to go through that process every 2-3 years and all the stress that comes with it. But also the cost of doing these assessments by contractors, by the government. I've been told it takes about £200 just for a contractor to do that assessment. Well, that will add up, of course, if you have many, many people who are on PIP and getting reassessed regularly. But yeah, any more questions or reflections?
You've got lots of thank you, Sharon. It was a brilliant and clear talk.